That's good. That's good.
Hi guys, today we're going to talk about the Chevy Silverado Special Edition. Awesome. What's your first impression? I like say, this is one gorgeous truck. Oh, did I say there was only one special edition? Because actually there's 5.
For my synovial joint project, I've decided to make the elbow joint. I've decided to make the elbow joint from the medial view. My joint is made up of a 2x4, a chair leg, Play-Doh, tape, and elastic bands. The bones that make up my elbow joint are the humerus, the radius, and the ulna. On the humerus, there's a trochlea and a medial epicondyle. On the radius, there is a radial head, but it is covered by a ligament. And on the ulna, there is a coracoid process labeled in the blue. The articulating cartilage on my joint, I've decided to show the articulated cartilage surrounding the trochlea. It is labeled by this blue rubber band. And so the trochlea has articulated cartilage between it and the ocrinin. So ocrinin is labeled down here. It wraps all the way around, but the ligament is also covering it. But I've used different colors of elastic bands to show the ocrinin. And so the trochlea sits in the ocrinin, and it needs the articulated cartilage between it to allow for smooth movement. So the elbow joint sits in the sagittal plane, and it allows for extension and flexion for the movements. So for extension and flexion. The origin of the elbow joint is the humerus, and the assertion is the radius. The ligaments that make up my joint are the annular ligament, which is labeled in the yellow, and the ulnar collateral ligament that is labeled in the pink. And these ligaments help keep everything together, and it keeps the elbow in the right plane, which is the sagittal plane, and it allows for the correct movement, which is the flexion and extension. So it doesn't allow for medial movement towards the camera or lateral movement towards the back of the wall. So the muscles that help articulate my joint are the brachioradialis, the extensor carpi radialis brevis, the biceps bronchi, and the triceps bronchi. So with all the muscles, I have labeled that they are connected to the bone by a tendon. So the brachioradialis and the extensor carpi radialis brevis are connected by extensor tendons, and the biceps and the triceps are connected by tendons. So an injury that is related to my joint is the epicondylitis, the lateral epicondylitis, and it is known as the tennis elbow. So what happens is that it's where pain is found in your forearm, and it is caused by the strain and tension put on the extensor carpi radialis brevis. And what happens is that when there's a lot of strain on that, it causes tears in the muscle. And that makes it hard for people to lift simple things. And it takes a while, I believe it's 6 weeks it takes to heal the tendon's elbow. And you can do different treatments. And that's all for my synovial joint project.